Hi, it's State Representative Todd Stevens. I am here today with Valerie Palmieri, who is the Chief Operating Officer over at the Abramson Center, which is located in Horsham Township, but very close to the border of Montgomery Township. And they have long-term care facilities over there. And so, Val, thank you so much for joining me this morning.
It's my pleasure.
Yeah, this is a great opportunity, I think, for folks in my legislative district to understand the impact that the COVID-19 pandemic is having on our frontline healthcare providers. And, Abramson is certainly a key component of my legislative district and home for many, many residents. And I know, many families have had folks over there for a short-term stay. My father even was there for a short stint, I guess about a year ago. So delivered terrific care. But I want to talk today a little bit about how this pandemic is affecting you, your staff, your residents over at Abramson Center. So especially because we've seen, unfortunately, our long-term care facilities are being so heavily affected disproportionately by COVID-19. So can you tell me about, the experiences over at Abramson? What's going on over there, and how have you been navigating these last couple months?
Yeah, I didn't set aside 3 hours for this, but I'd be happy to tell you so many things that are happening. It's certainly intense over here. What was a lovely campus, vibrant, active campus of 324 nursing home residents has really changed. Our residents are not having visitors. There's no volunteers here. Everyone's monitored when they come in as far as staff. The residents are monitored twice a day for certain symptoms. And so it's an intense feeling when you come here. It's sad a little bit because it's been going on for weeks, right? So we've been meeting twice a day for many weeks now in planning, training, resource allocation. Nothing is in unlimited supply. And so every piece of equipment we have, we know where it is, how it's being used, and how we could, optimize its use. And, when you talk about allocation of resources, you're also talking about human resources. We're dealing with people. It's a people business. And we care about the residents we serve. But I'll tell you, the people who work with us to make this happen are just as important to us, and keeping them safe, keeping them educated. We're constantly having to battle the social media rumors or the news media or what's out there. We're constantly having to battle that with our staff so they have the confidence to do their job every day.
Yeah, it's interesting you brought that up. It's something I deal with as well. I mean, I know a lot of folks watch national news, and so, something happens in Arizona, California, Georgia, and all of a sudden, it's, people are assuming that that's happening here, and it's just not the case. I mean, not only is every state different, even in Pennsylvania, we are just so dramatically different and diverse. What's going on in Montgomery County, and in particular, even my legislative district, is very different from what's going on elsewhere in Pennsylvania. Sadly, just the 4 townships I represent have more positive cases and more deaths than most counties in Pennsylvania. So our experience is really different. So, what changes have you instituted at your facility, to help address these impacts that you described?
Well, of our 324 residents, we have 12 what we call households. Well, I'll call them nursing units, so it's easy to understand. So we totally cleared 2 of those nursing units, our 2 short-term units, so that we can serve the COVID positive population. And because there's such distinct units, we're able to do that effectively. One of those units is for people who are testing positive, and they can recuperate there. The second unit is meant for those who we affectionately term presumptively positive, people that, that old saying, it quacks like a duck, it walks like a duck. We think it's a duck, but they're not testing positive, but we want to protect our long-term residents. And so by placing those residents in that presumptively positive section, we can really protect our long-term residents. Our average age is 88 here, so we have a very frail older population. And so that seems to be working for us. We haven't done broad testing, but we're testing people who have symptoms and anyone who they may have come in contact with. So as I said, we tested over 130 people selectively. I'm sure if we tested everybody, we'd have to segregate more. But right now, this seems to be working. It's been working for weeks for us.
And you're talking a little bit about, the benefits of the physical layout at the Abramson Center. I mean, we were talking earlier about your ability to really close off certain sections and, still deliver top-notch care and provide services to the residents that are living there without them, without the risk of them cross-contaminating, other areas of your facility. Not all facilities are that lucky, obviously. And I know that I've worked with your physician over there, in terms of securing PPE, and we've had a lot of conversations about testing. And I know you guys have been really, aggressive with that testing, which has really enabled you to isolate those folks who are positive and protect the remainder of your population. Can you talk to me a little bit about personal protective equipment? How's that been going for you? I know that early on, at least when I spoke with your staff over there were a lot of concerns, and we were able to get some of those resources pushed in your direction. How are you holding up now?
We're in great shape right now with the population that we're serving right now. If we get a surge, we'll be scrambling a little bit. In the beginning, I would say early March, when we were just talking about it and meeting and planning, there wasn't any orders that we had out there for N95 masks or gowns or even regular surgical masks. You could order anything you wanted, you just couldn't get it. It just never showed up.
Right.
And it's been amazing to me, the people that have come out of the woodwork to sell you tractor trailer full of, prepay, no delivery date, but the strange folks that come forward. But we've been so blessed with deliveries now starting to come through. Pima has come through with some supplies. We have gotten donations of supplies, which have been fantastic. And so we are great now, but there was a time where we were significantly concerned.
Right. How about testing? Have you had any problems getting the testing that you need?
Testing is limited. We do, as long as we have the swabs, we can test and we send it off to Abington Labs. The tests are coming back faster in the beginning. Early April, feels like a month ago, almost, but early April, it was taking a week to get a result back. Now we can get some results in 24 hours.
Wow, okay, that's great. So how are the residents holding up over there? I mean, I know you mentioned that now, it's a different place, the feel over there. I mean, I've been over there many, many times, and, my staff is there, monthly for, to provide services, but it's always a very homey, welcoming kind of place. I know it's not that way right now. Without the volunteers and, sort of the visitor interaction, how are the residents doing? And what are you doing to help them cope with that?
It's a hard story to tell because all of our households are contained. Residents can't leave the household. Many of the households, the residents can't leave their room because they're on droplet precautions. There's no congregate dining. They're eating by themselves in the room. But one of the things we've done is certainly ramped up our Skype visits and FaceTime visits with family. We've put a recreation staff person 7 days a week on each of the 27-bed households to consistently engage residents. I think the hardest hit are our residents with cognitive losses, because that routine of mealtime and getting dressed and getting up and seeing other people, that whole social aspect of breakfast, lunch, and dinner and activities, when that is changed, it really impacts them the most. And so sadly, I think that's been a tragedy through this, that they've really struggled.
Yeah, for sure. I mean, my wife and I were just talking this morning about, how we're really fortunate in as much as we at least have all this technology now. While people are stuck at home, ironically, because of an incident with some digging in my neighborhood yesterday, the whole neighborhood was without internet or TV. With everyone's kids at home and everyone trying to work from home, it was a challenging day. But it made you realize, how fortunate we are that we can Skype with loved ones and family members. We can, still keep in touch with the outside world. It's not the same, you're right, as that personal contact or sitting down to have a meal with a number of other people. I would imagine there's people too that might have friends in other households that now they can't even socialize with, right? I mean, that's got to be the case.
Imagine, Todd, as table mates that you've formed a relationship over the years, or even months. And that is a disconnection that yes, it's technology helps, and connecting with family on technology, but really it's so hard not to give some of these folks a hug or touch them. They're longing for that, and it's hard.
Yeah, I can imagine. That covers the residents. How about your staff? This has to have a tremendous impact on staff, in terms of their daily routine. So how are they holding up, and how are you helping support their efforts?
Well, they're a very robust group, but it's difficult to talk about because they're struggling. They're hearing what's in the news. They have to get on a bus to come here, most of them. They're sitting next to each other, covered, it's a struggle for them. They've got families, they got kids that aren't in school.
Right.
And it is a struggle. And so what can we do? We give them, high fives, virtual, snacks, we feed them, we communicate. We do written communication. We have electronic boards. We send videos. Every few days, I'm posting a video of like encouragement and dispelling some rumors. I won't tell you some of the funny rumors, but there's been some funny rumors out there. Okay. And, it catches on like wildfire.
Right.
They see something in the news, like from New York, where nurses were using trash bags for gowns. And so even though we had gowns, we started to see staff starting to maybe hoard the plastic bags just in case. It's right. A constant tide of keeping the right information out there and keeping them moving forward. But I'll tell you, they're very motivated. Our call-offs have not increased since this period. I really expected them to. Frankly, I went to the staffing coordinator and said, how much has this call-offs increased? And she said, they haven't. And she showed me. And it was really heartwarming, aside from some that self-quarantine, but that's going to happen.
Yeah, that's terrific dedication that you haven't seen a drop-off in people calling out. That's unbelievable. And you're right, the lengths that they've got to take, many using public transportation. And then, I've heard from many the concerns about returning to their own home with their own family members. I was talking to a neighbor who works in a facility, a hospital, and she gets changed in her garage when she gets home from work. She just totally changes her clothes, puts her clothes that she wore to the hospital in a plastic bag, and then puts them right in the washing machine because she's worried about her own family. Along those lines, I know that facilities like yours run on really tight margins. How's this affecting your budget? How are you going to navigate those challenges, or are there challenges there, or are you faring well with the budget? How's that going?
As unthinkable as it is when we consider the amount of people who are at risk of dying from this disease, it's also unthinkable when you try to contemplate the losses of revenue for everybody every empty bed. We're not used to having empty beds, and we have empty beds.
Right.
And the impact of this supply. We spent at least $1 million more than we typically would have spent just on supplies.
Wow.
But and the staffing, to feed our folks, or to pay overtime to have them cover, or to we pay a little premium for them to work on the floor that's strictly COVID. We want to incentivize them. They're going through a lot, and they're seeing a lot of difficult situations.
Yeah.
So it's going to be exponential, the cost.
When you, I know you mentioned the cost just for equipment would be, an additional $1 million. Do you have a rough idea in total about what your increased costs have been over the last, several weeks that we've been dealing with this?
it would be a total guess, but
Okay. Yeah.
it's wild.
Yeah, I'm sure. I'm sure.
It's
Um,
in the millions, Todd.
yeah, I'm sure. And look, I mean, a lot of that is going to, our state budget obviously is something that, we're starting to take a really close look at, and, we're going to feel the impact as well. And I know that through many of our programs, we try to assist, our long-term care facilities, and there's a lot of state funding that ends up, running to these programs. So we're going to have to step up and try to figure out how to help to make sure that you can continue to deliver the great care you're giving. So that impact is going to be felt all the way around, I'm sure. Let's talk a little bit about, I've heard a lot, and I've had a good opportunity to talk with your CEO over there, Carol Irvine, regarding the type of information that you provide your residents about positive cases and the protocols that you involve. How much transparency is there? What type of information are you providing, and how are you providing?
We're a pretty transparent organization. We wear everything's on the outside here. And so as soon as we were gearing up for this pandemic, we sent letters. We kept the families and certainly our board, but families, staff, residents apprised. As soon as we had our first case, we notified every family, and every family, the affected household. When there's been additional cases, we've notified the families, that household, the residents and families. We gave a general overview. We're not giving numbers, because I will tell you, even as a COO, the numbers I get in the morning, because of our aggressive testing and our targeted testing, by noon, the numbers are different. By 4 o'clock, they change again. So it's hard to put out, it would be tragic to put out like a little ticker number. It would be awful.
Right.
But, and I think we have to put it in context too. So if you talk about a 100-bed building that has 50 cases, and you might talk about the Abramson Center with 324 beds with 22 cases, it's just, you have to talk about it in percentages. And I think it's always interesting when Carol and I, the CEO, talk to families. Our cell phone number is out there. We put it out there because we want people to call and ask us if they have any questions beyond what we're communicating. And I always say, yes, there have been deaths associated with this disease here. But did you know we typically have 10 to 14 deaths a month at the Abramson Center? Because we deal with a frail, older population. They're always shocked. So just to put out the number of people who died would be, it would be out of context, because what they have to hear is, what's our typical number of residents who pass, and then who has passed from this disease?
Right.
And so, yeah, I'm all about transparency, but I'm also about context.
Right. No, that's very important. That's critical. Well, I think you've given us a great overview. I mean, is there anything else that you think the community would benefit from hearing about in terms of the impact that this COVID-19 crisis is having on either your facility, your staff, your residents, anyone in between?
Yeah, actually there is. There's one more thing.
Yeah.
And that is, I think I would want the public to know, I think there's a misperception that nursing homes don't have any oversight, that we're policing ourselves, that because there's no visitors here, that, things have run amok. And I want people to be rest assured that there's significant oversight. It comes from the county health department's involved, the Department of Health in the state. So there's a lot of oversight. I just would love people to not be scared, that we have really, every nursing home is managing, and they're doing the very best they can. And the residents are, if they were home, they'd be dealing with it as well. So they're dealing with it. We're all in this together here, and doing, I think, a remarkable job of keeping life as constant as possible for these older adults.
That's great. Well, Val, thank you so much for letting us into the Abramson Center and helping people better understand all the challenges that you're dealing with and how you and your staff and residents are all coping with this difficult situation. And thanks for all you're doing for all the residents over there at Abramson.